Well, hello there, everybody. Welcome to Junk to Jewels podcast with Georgette Beck. Today, I have a special guest, my dear friend, cousin, who the world now knows as Dr. Cassandra Munro. She's an entrepreneur, innovator, and nurse scientist. She's internationally known for her research, perioperative practice consultation, and education. Dr. Munro has been a perioperative nurse for over 27 years. Currently, she is a nurse scientist at Stanford Health Care, Office of Research, Patient Care Services in Menlo Park, California, and principal consultant at Munro Consulting in San Francisco Bay, California. She developed, validated, and implemented the Munro Pressure Injury Risk Assessment Scale for perioperative patients, Munro Scale. Dr. Munro has provided the leadership and mentoring to over 30 hospitals, organizations, and systems implementing the instrument within the United States and 17 sites abroad, including translation into 5 languages thus far. Understanding the importance of translating research into practice, she wrote and disseminates the CMUNRO SCALE curriculum, an education resource to support implementation of the Munro Scale. Dr. Munro is also the 2023 recipient of the AORN Excellence in Perioperative Nursing Award, and that is the Association of Perioperative Registered Nurses for those of us not in the know. She's done some amazing things. That's the highest honor bestowed by AORN, recognizing an individual whose work and accomplishments has had global implications on perioperative nursing in the areas of practice, education, and research. And this last October, 2023, she was inducted as a fellow of the American Academy of Nursing. She believes divine destiny and divine intertwine has guided her purpose-driven life. And not only that, she received the Best in California in their magazine's Excellence in Nursing recognition. Welcome to the podcast.
Thank you, Georgette. I appreciate you inviting me here.
Well, let's dive in. Let's share about who are you to the world and where did you come from? You started from somewhere, not you're at this level now, international level. Share, who are you?
So as you may recall, as a family member, I was always called Sandy. So my story really starts back with what I would probably coin as my biography, 7-year-old Sandy. Those are some of my earliest memories, probably even before 7. I recalled some of the most memorable impressions I have in my childhood was a sad one. My parents came into the bedroom, had all 4 of us kids lined up, and they announced that my father was leaving. And that was devastating. I couldn't possibly understand what was going on in their lives at that time to make such a difficult decision.
Yeah.
And then one of my other very impressionable events that happened that really made me question about who I am and what am I doing here was when I was 16-year-old. As a 16-year-old, I was with my mother who in tears divulged to me her decision to try to want to terminate her pregnancy, me. And it was something that she said she begged the OBGYN to end the pregnancy, but he pleaded with her and said, listen, if it happens again next time, maybe, but let's keep this child.
Wow.
And when I was born, that same doctor said, and my mother wrote right into my baby book, this child is something special. And it's not just because I had a blonde streak in my hair and all the nurses were running to the nursery to check out this new born baby who had a blonde streak in her hair, because that's something that they were doing and was in style back in the day. So there really was a lot of questioning in my younger years about, who am I? What am I doing? And there was some times where, for example, at church, there was a missionary who came to us from the Philippines. He was sharing, it was a missionary that our church was supporting. I listened to him intently as he spoke from the pulpit, And he shared about a vision that he had while he was praying. And he saw a young woman, and he saw this woman was going to be very integral in health and healing for people at large.
Wow.
Later, at the end of the service, I was in the offices of the church it was part of my capacity to serve at that time. And this practically fell over when he saw me. And he kind of was startled and like he had seen a ghost. And he had asked me, who are you? And of course, I shared who I was. Well, he later divulged that I was the girl he had seen in that vision.
Oh, wow.
And for many years, I thought to myself, oh my God, what God did you say to him? What did you show him? Tell me again. Like, I wish I had notes. I wish I had the recording of that session. And so I was desperate to try to really seek and find what did he tell him? And there was another event that after years of struggling to try to figure out who am I? What am I doing? And what did that man see? I finally had this epiphany, and I was at another church event. This was a women's only event called God Chicks. And we had this moment and epiphany of recognizing that in our lives, in our journeys, we are right where we need to be. We have experienced what we've experienced to form us into who we are, and that we have gone through some of our trials and tribulations, or some of our challenging relationships, and some of our childhood experiences to form us into the beautiful jewel that we are. And so I stopped seeking what did that man see about me, and I started to seek God and what did he see about me, because I didn't feel worthy of notice from God until that point of recognition that I personally have a relationship, and my family has always been the church of God. I have a father who loves and cares about me and doesn't leave me ever. And I certainly have relationships with both my parents, and they are, they were young and they were not aware of what their actions had done and the impact that they had on our lives, because it wasn't just me who was present to hear the news. And I'm recognizing that my family is also the church.
Yeah, true. Very true. I love the God Chicks, Sandy. And I love that you learned I had to learn later how God is our Father and he never leaves us. And as you know, my dad passed away just recently. And I talked about that in a tribute, that sometimes, we grow up with our own perspective that came from a childhood perspective of our parents and their actions or inactions. And then, you glean the nugget of they're a child of God like we are, and they were just going along in life like we tried to do and figure out things. And seasons come and seasons go, and we glean that knowledge slowly but surely. But it's powerful, isn't it? It helps you just to drop what just needs to be dropped and gain new, higher perspective with God's light.
Mm-hmm. Absolutely. And in life, our journey requires us to be compassionate and not judgmental towards those who have encountered us in life. And
especially
even with my church family, there were some broken relationships that made me no longer welcome at a church. And that was devastating for me, thinking now this is my family, and not being able to go to where I had all of my circle of friends and connection and network, and where I had gained so much knowledge over the years and really established roots in understanding and learning how to serve. That was something that I had to come to terms with also, that we must forgive. We must move on. We shouldn't hold on to resentment. I, in the healthcare setting, would like to liken unforgiveness and resentment to the cancer of life. It is something that eats away at you and only you, not those people who may have in ignorance offended us. It is only you. So forgiveness is essential, an essential part of the healing process.
Yes. Oh my gosh. There's research that backs that up, actually, that unforgiveness actually is a root cause of some sickness and disease.
Mm-hmm.
And, right. And do you know, I don't know about you, but God, so I immediately, my journey too with forgiveness was forgive everyone else. But he had to say, Georgette, I know you know about your faults and failures, but you have to forgive yourself too. Because I was highest on myself. I had the highest standards for myself. I don't know if you experienced any of that, but that meant us too in our own failures. We have to forgive and then work on them.
So Georgette, it's funny you should mention that little bit of pride that really excuses us from the need for forgiveness. I have always likened myself to the big brother of the prodigal son. When you think about the prodigal son, he's the one who gets all the attention, right? He goes off and lives it up and disobeys and, wreaks havoc and he gets all this attention for all the bad things he has done. But there's an older son who's back at the house who is well behaved and basically complying with all the rules, but just never realized how much pride had potentially interfered with his capability of being under the graces of our divine Father, and recognizing that we too have a potential of having distance from God if we create a sense of, I don't need forgiveness, right? I'm perfect the way I am. No, we have to humble ourselves as the older brother of the prodigal child.
I so heartily agree. And the biggest thing too was my real issue was I blamed myself for everything. So that also is, I honestly, some pride could have done me good in that situation because I was so like, oh Lord, it's all me. I'm so sorry. And then I couldn't forgive my stuff. You know what I mean? Not that I didn't need forgiveness, but anyhow, it's both sides of that. We don't realize that God is speaking to us on all of that. So you're at a juncture you had a marriage during that after God, before or after where you realized God was your father and they had that two-way relationship?
So I think needing a clarity and a sense of who we are and what our divine purpose is, it's difficult to come into any relationship as a whole person. Yeah. And in addition to my divine guidance, which I've received throughout the years from, various churches that I've been a member of, but also books that I've read, and even watching live online or recordings of church services, that sustained me for a period of time in my life where I had some true growth. So I give kudos and credit to those that make available their services online. But even with counseling, I have always had, during a period of just ending a relationship, I have sought out counseling. And I think the church has gotten wise to recognize that, pastors are not licensed family and marriage practitioners. And yes, they're well-versed in the scripture regarding relationships, but it is also necessary for us to seek that outside counsel. Christian or not, there is wisdom, and it is all based on evidence, which is through research. So I have been well guided and understanding and having that internal perspective and recognizing, what do I need to change about myself so that I can be a better person? And currently I am very happily married and have found someone that I had to change my criteria for who I would allow in my life, because that was also a barrier for me being open to receive a healthy relationship. So we are quite compatible. We are healthy. I am happy to say, after being together for over 5 years, we have not had an argument yet. Now, we may not always see eye to eye, but we certainly have not had an argument. And I did forewarn him. I come from a long line of screamers. I might get a little more animated, but he is such a patient man that his responses to me are always like a mirror, like a reflection of how I should behave towards him, because he deserves to be treated with that patience and kindness too.
You touched upon something ever so lightly, but I just want to dive in just a tiny bit deeper, because I also related that in my journey. I have that book coming out, Junk to Jewels, A Journey from Brokenness and Despair to Beauty and Delight. And one of the things I said that I noticed, as I was in my current condition, emotionally, spiritually, mentally, that's who I attracted into my life. And it wasn't until I started going to counseling, seeking help, reading the books, getting pastor counseling, I did all of the things. They all helped. Then all of a sudden, my second chance guy too, Scott Beck, and he come into my life, and I never would have known such a man if I did not do the hard work before him. Do you agree? Greg is awesome. and I had the pleasure of meeting him. And you two are such a fine match. And it's like he's part of that destiny path, because after all your hard work and journey and to get, the truth and healing and love and finding your purpose, he's part of that plan. And isn't that cool?
It is absolutely amazing. And God really knows what we want and what we need. For many years, I dove right into education, and it became something that acquiring degrees were my personal goals. And the success I was having was fantastic, that it became an insatiable desire. So pursuing the PhD was what I keep still trying to convince myself is the last degree. But in a time in my life, always needed like time alone and realized I needed to be able to focus on my studies. Yeah. Greg came into my life at the perfect time. I finally recognized I didn't have fun in my life, and he brought back fun. And that was just the best way for him to be able to connect with me, because he got me back cycling on the bike, which I had given myself permission not to do, and created a hiatus for what I thought was necessary. But it really was necessary to have fun and a healthy relationship in my life. So yes,
work hard and play hard.
Exactly. Work hard and play hard.
You did a France detour. Well, no, Tour de France. You participated. Can you explain what that was?
Yes. So I have for years watched cycling. In fact, Greg and I continue to do so. And one of the most exciting tours is the Tour de France. And this is one of the most grueling challenges for cyclists. And it's a very prestigious event. Well, I was able to join a Tour de France tour, and it was a tour group, Trek Tours, who took us out onto the actual course where the pros were riding. And we would ride segments of the tour. We would stop and have a lunch and watch the tour ride through and past us. And then we would ride back to our hotel, freshen up, and have a fantastic French meal with, of course, fantastic French wine. And we did this day after day after day up until the point where we were in Paris for the final event. And so it was really a trip of a lifetime. And of course, I had to train to do all of that cycling. And as you're riding the streets, the people in the local communities are out cheering for you, LA, like you're one of the pros. So
love it.
It's exciting.
That's definitely fun. And you also ride another bike, dear cousin of mine, Dr. Munro. Can you please share about this other bike before we dive into the professional side of you soon? Because this is for Dr. Munro. But what are you doing for fun besides the cycling? And go.
So yes, I own my own Harley Davidson. I have a Sportster. My husband also rides his own Harley. He's not on the back of mine, and he has a Road King. And we just love getting out on the motorcycles. It makes those other hills that we cycle on so much easier to climb.
Oh, yeah, amazing. Oh my gosh. So you have a master's degree. You went and got your PhD.
Yes,
what are you doing exactly? Explain the Munro Consult. You have Munro Consulting. You researched and innovated. You created the Munro Scale. Can you explain that to us in layman terms too? Because we're not all the scientists and doctors.
Absolutely. Yes. So actually, it started when I first started to explore my master's program. I was coached very wisely by other nurses who said, be sure to grasp the idea of what you want to conduct your thesis on. And I recommend that to everyone early on, grasp that idea so that every piece of your coursework builds up towards your thesis. And then this became something that, of course, was the focus of my PhD and then the dissertation for the PhD. But what had happened is I was in front of the classroom and I really thought I was just randomly picking a topic for the first course and the first assignment. So I found that in our operating rooms, when we position our patients, we actually, because of the sheer environment of undergoing a procedure, having anesthesia, there are many risks for these patients to come out with unexpected pressure injuries. And so the literature was very clear about what that looked like. So in front of this classroom, I am presenting, and I barely get into the presentation, just a couple of slides in when I'm sharing the statistics discovered through the literature. And my professor interrupted me and said, "Oh my God, Cassandra, did you hear what you just said?" And I kind of was like very task oriented and didn't really absorb and think about it. And I said, "Well, what do you mean?" So she said, "Do you mean to tell me that almost half of the patients who go into surgery could come out with one of these pressure injuries?"
Yes.
And I said, "Well," kind of pointing to my slide again and saying, "Well, that's what the literature said." She asked me a very crucial question. She said, "So what are you going to do about it?" Well, I was grateful that the literature actually told me what to do about it. And so I started to develop and fill in the gap. Now, a pressure injury for the layman persons used to be called bed sores or pressure ulcers. These are not those type of injuries you're thinking of when you think of patients who might be in a long-term care setting. These are from the more acute setting of having surgery. So we actually call them perioperative pressure injuries. So I did it, filled in the gap. I created an instrument that has now been translated in over 7 languages. It's been used in over 25 countries. It's been implemented around the world. And I continue to conduct the research necessary to ensure that this instrument is continuously validated with the new evidence that comes out through research.
And I have to ask, because I've had a few surgeries, and I have to say, I believe I also experienced pressure. Now, for instance, wouldn't this mean, so I had a shoulder surgery. They have to sit you up and I'm sure buckle you into a hard back. I wasn't in the room, but that first night, you would think this shoulder would be screaming at me, but it was actually my lower back through the medication. Is that one of the examples? And I'm not going to name names or anything else, but does that count as a pressure thing?
Unfortunately, without me personally assessing your physical condition, I wouldn't be able to verify. But unfortunately, this is what ends up happening is discomfort in an area not where your surgical site is one of the triggers for us to recognize we need to be careful with this patient. We need to identify what has happened in the surgical procedure room so that we can prevent it further on beyond where they are after.
And how does the scale help? Is it something that everyone does pre-op or post-op or both? And has it reduced? Has it helped?
Yes, there's a couple of questions there, and I'll start with the first one. What's unique about the instrument I designed is that I don't stop with just a preoperative assessment, because that's not where all of those risk factors are introduced. Preoperatively, we recognize what does the patient bring to the table, right? What is going to happen based on how the patient's current condition is before we even touch them with a procedure. Then intraoperatively, we have a lot of high risk variables. For example, one of them is the length of time you spend in that position. That cannot be determined preoperatively. So we cannot use an estimated time. We have to use the actual time. And then even in the immediate postoperative recovery period, we're still evaluating risk because we want to finalize the amount of time, because it's definitely, if you're in the same position where you were on your bottom, right, for that extended period, certainly postoperatively, you were most likely in that position as well. So the ability to prevent these, and this is what the instrument does. We first have to identify those who are at greatest risk, and then we have to communicate that level of risk beyond the perioperative setting. We have to let those inpatient nurses know what has happened behind the red line so they can continue preventative measures.
Excellent. I love that. Now, you are also part of the Stanford Health Care. You're a nurse scientist. That just happened too. Can you explain this role?
So I'm going to mention Greg again, because about 5 years ago, he asked me, what would be your dream job? And when I responded to him, I had never seen the position created, but I theoretically identified to him, I wanted a position where I could be a nurse scientist to help clinicians. But I didn't want it to be solely focused on what happens in an academic setting where you become the teacher for all things pressure injury. So I wanted a balance of both a healthcare affiliation with a university setting, but I also said to him, and I want to be able to continue to do my consulting that I do independently. Well, guess what? Today, that's exactly what I have. I am a nurse scientist with a team of prestigious and well-trained nurse scientists, and we are in the Office of Research, and we provide our services to the clinicians and to the healthcare providers so that we, as the scientists, can lead them through the research. So as a frontline nurse, you don't have to have a PhD to be involved with research or to even generate a research idea. We're the ones who take you through that process.
I love it.
From the university's perspective, I, of course, am a guest lecturer in a program at the School of Medicine as well. And then, of course, I have some time left to do some of the consulting that I do, and I volunteer quite a bit for a couple of national associations.
So is this open to the international? I mean, can any organization contact your team? And I love how you wrote, you help people with their ideas. And, if it would be better if, or I wish we could, and you help them get over the fear of research and you kind of make it a fun thing with your creativity and your innovation.
So the Stanford role is for Stanford, but that is where my consulting, I have been a consultant to sites around the world who are implementing pressure injury prevention programs and wanting to have the latest evidence in what's available for risk assessment as well as preventative interventions. And I've also helped some industry partners in guiding them with their research ideas as well.
I love it. Oh my gosh, I'm so excited. So you just went for it, and these things open up. And we call it, we both believe in divine appointments, and that you also divine what is the intertwine, divine intertwine. And I also love serendipity and synchronicity, because when you are really desiring to do your purpose, it comes to you. But it does ask of us to be all in, right? So
Absolutely.
now, you have along the way, I know I'm an educating proponent as well. Education's so important, whether that's, school, degrees and or books and lectures, podcasts, and then counseling, all of that to gather the facts about your life. Know who you are, know where you came from, do all the work, forgiveness, but then have fun. What is your passion, right? So you found something you were passionate about, and God gave you a vision. Someone actually had a prophecy. And so all of those things, it's funny how God brings you back full circle. There are little dots in your life when you're going through the path, but then God brings it all back together and shows it. Do you have a favorite book or a scripture, probably both, that it helped in such a great way, and maybe a mentor? So there's three things possibly you want to respond to. A mentor that impacted your life?
So I'll start with the scripture. And really this stems from the childhood perspective, because there are so many scriptures that I just gravitate towards. In fact, I've created my own little booklet of scriptures that are really meaningful to me.
Yeah.
The one that stands out most in my mind is Jeremiah 1:5. And I'm going to read the first component of it. It says, "Before I formed you in the womb, I knew you. And before you were born, I consecrated you." And that's true of my life. I know that there was a reason that I was born, and this is my divine destiny. And I believe it's a purpose-driven life, which I have gained so much insight and knowledge from some of my favorite authors, or, for example, Lisa Bevere. And one book that stands out most significantly to me is Lioness Arising, Waking Up and Changing Your World. So she, along with Christine Caine, and while there's many, many others, they've inspired me, because Christine Caine, for example, with her children in tow, she was traveling internationally. So yes, we can do it all. That's one of her books. And I believe that we are inspired by people who are in our circle, and people are always in our lives for either a reason, a season, or a lifetime. And we have to recognize that. And someone we think may be in there for a lifetime, it may just be a reason or a season. And so I've had many blessings of relationships, close friends, as well as those from afar who I've just heard in messages being shared online.
Yeah.
I'm going to say professionally, I definitely have some clear-cut mentors. Jaleh Akavan is one such woman who is just a beautiful, nurturing person who really instilled in me the recognition of pursuing goals personally and professionally. And believe it or not, she also helped me to recognize balance. But she was so instrumental in me really seeing the clear path and direction of my professional career. So I just want to give a shout out to her. And when it comes to personal relationships, I'm going to say, my dear friends, one thing that happens when you're with a counselor professionally, they all of a sudden look at their watch and go, oh, it's time. Well, my friends never did that to me, right? We can actually gain some great guidance and, sure, we have to weed through some thoughts as being, maybe not relevant for us, but others, we take it into consideration. So I'm just going to give a shout out to all my friends near and far.
Oh my gosh. Friends are the best, especially when they listen. I learned too that listening, I have to work better on that, to be honest. I'm a talker and it comes easier, but listening is the greatest act of love we can give someone we care about. So thank you so much, Dr. Munro, for being our guest on the Junk to Jewels podcast. And I know it's never, like, you're going to agree with me too, right? I'm coming into my divine destiny later in life for whatever reasons. It's not too late. If there's something in your intuition, in your heart, follow it, go after it, right? Go after it.
Right. It was one of my counselors who actually said to me, Cassandra, by the time you're age 50, you're going to figure it out. And she was spot on.
Yeah, I love it. It gets better as we age, like fine wine.
Yes, exactly.
You. Oh my gosh. So we're going to just give everyone, you could follow Dr. Munro. She's with Munro Counseling, Munro Consulting. So reach out to her. You can find her. Are you on Instagram?
I believe I am still on Instagram. I'll be honest, I'm not connected well with the social apps. So my website is probably the best way to get a hold of me.
Munro Consulting. Thank you so much for being on our show today. We appreciate it. And God bless you. And God bless our listeners and viewers. If you like, please subscribe and have a wonderful day, afternoon, or whatever it is time you're listening. We appreciate you all. Take care. And don't forget, if you're not following Georgette Beck on Facebook or Instagram, please go ahead and follow. And then please download this show and follow Junk to Jewels podcast with Georgette Beck. We have several guests coming along to share their challenging moments and their inspiration. Thank you for listening and watching. Take care.